This is Dr. Charles Haggerty. We are going to demonstrate exercises after your shoulder surgery for your home exercise program. They include the French stretch, which is in 2 phases, as well as the door stretch, the Superman stretch, and the tabletop breaststroke. We will review these in a clinic when appropriate. This demonstration is to facilitate review for you at home while you're recovering from surgery. Now I'm going to demonstrate the French stretch, which you will start for passive range of motion exercises after shoulder surgery. You will lead with a non-operative arm. You want to make sure that you're centered and that your hands are flat on your forehead. When you do this, you will passively use your upper torso neck to kind of stretch up, and then you will come down. When you do this, you will do this 3 times on odd hours. You make sure that when you go up, it's like climbing up a ladder to the roof. You don't jump off the roof, you come back down the ladder. So it's important that you come down the same way that you went up. And that will be phase 1 of the French stretch. Now we're going to demonstrate phase 2 of the French stretch, which is also known as building the Eiffel Tower. Once you can easily get your hands to the top of your head, you'll slowly use your non-operative side to go up, and then come back down, and then up, and down, and up again a 3rd time, and then down. Making sure that pain is your guide. You can feel a pull or stretch, but there should be no ripping or no tearing. We are now going to demonstrate the Superman stretch, which is used for passive range of motion after shoulder surgery. You'll find a nice flat surface where your arms can glide. And you need to make sure that your arm is down so that the table supports the weight of your arm. You don't want to be up. And as you do these, you will slide both arms in front of you, and then back, and then in front, and then back, and then in front, and back 3 times. Once again, pain will be your guide. Achiness and soreness is okay, but there should be no ripping or tearing sensation. We are now going to demonstrate the tabletop breaststroke. It's very important, like the Superman stretch, that your arm is down flat so the table supports the weight of your arm. When you do this, you can control 2 things: how far you lean out, a little bit or a lot, and the size of circles, huge circles or small circles. Everything should be medium, like wading in a pond or a pool. Nice medium circles in front of you. You'll start off with a set of 10 and build by 2 until you're doing 3 sets of 20. What we're going to demonstrate next is called the door stretch. This is to work on passive range of motion, external rotation for the shoulder after surgery. You will go to the threshold of a door, and that's why it's called a door stretch. You want your arms at your side like you're a robot, and there's a tendency to lift the elbow up and to move the wrist. And so you want your wrist past the threshold, and once you're there, you will just slowly rotate your body away, being mindful to keep your elbow at your side. If there's a tendency to lift the elbow up, you can put a small box of Kleenex by your elbow and pin it to your side to help remind you to keep your elbow in. We will demonstrate these exercises in clinic. They will also be available for your review on the website. If you have any questions or concerns, please give us a call. It's very important that you engage in the activities of the home exercise program as directed to maximize your outcome in healing with shoulder surgery.